This is LiveWell Talk on genetic testing. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health, St. Luke's Hospital. There are many factors that can cause cancer. Some we can control, such as diet and exercise, but other factors, for example, genetics, are out of our control. However, there are resources available for individuals with a family history of cancer to help them understand and to minimize their risk for cancer. Our guests today are Melissa Janssen and Alyssa Grissom, genetic nurse clinicians with the Genetics and Cancer Risk Assessment Clinic at Nassif Community Cancer Center. Melissa and Alyssa, that's kind of hard to, that's a good combination. That sounds like I don't know.
It's quite the duo.
Yeah, it is. Yeah, it doesn't sound like a law firm or accounting firm. I don't know.
Alyssa.
Yeah.
We really have to enunciate on the phone when we're talking to patients. Bet. Yes. We need a better nickname for each other, but we haven't come up with anything. So if you have anything by the end,
or maybe listeners could send in if they thought of a better
shoot us
ideas. Lisa helps that you're blonde, I'm brunette. So the blonde one or the brunette one?
Yes.
Yeah. Could be, like Tango and Cash or something like that. I don't know. Anyway, tell us about the genetics clinic. I mean, I think people understand what genetics is, but yet they don't. They see 23andMe on TV and Family Heritage, Ancestry.com, etc. But just give us an overview of the genetics clinic and risk assessment and what it offers.
Sure. So in our clinic, we kind of have three things that we focus on: cardiac genetic screening and cancer, hereditary cancer genetics, and then we do pharmacogenetic testing. And so we're all born with genes, and in that we may have certain genes that put us at risk for either cardiac diseases, cancer, hereditary cancer diseases, or then in the pharmaco world, that's looking at if there would be medications that maybe we are more susceptible to not tolerating, or if we would have side effects for them because we have a gene that we are born with that is never worked from the time we were born, that may be putting us at risk. And so we can look at your DNA and it would tell us, depending on what we're looking at, cancer, cardiac, or the pharmacogenetics, if you are at risk for whatever specific area we're kind of targeting. And we combine that with maybe your family history, your personal history, and then your DNA to get a better idea if you may be at risk for, again, the specific area we're looking at.
So do I need to have a family history to have a risk assessment, genetic risk assessment?
It definitely helps guide what we would test for. So the more information that we can collect about your family, we would want to make sure that we're covering all the testing options that are appropriate, for your own personal kind of medical history, but also we can get more ideas what we kind of see in the family, what kind of testing, because you can test one gene, you can test hundreds of genes. So there's many different options. So the family history really guides us into what testing is appropriate for the person.
Certainly if you are estranged from your family or adopted, those are maybe scenarios where we see someone who doesn't have that family history, that we can work with you and get the information the best that we can. And then we rely solely on your DNA. But like Alyssa said, it helps paint a bigger picture if there may be something more that we can target to look for in your personal or family history as well.
Well, let's carry that a little bit further. My parents have both lived into the 90s, let's say, and not had cancer. Does that give you some direction too on that? Like a healthy family history as well?
I always tell people we don't have a crystal ball. We can't predict anything. It certainly
that's the question I'm asking.
Is more favorable when we see longevity, not only in your parents, your grandparents, maybe your aunts and uncles, but then we also look at your cousins. Are you an only child? Do you have 10 aunts and uncles on both sides? Do you have 50 cousins on both sides? Is there only one incidence of, say, cancer? Or do you have 8 uncles out of 10 that have all had a cancer at a very young age? And now you're starting to see some of your cousins also having cancer. Those would be the types of questions that we would delve into a little bit more. And, this isn't necessarily the dinner conversation that comes up at Thanksgiving, but those are some of the things that help paint a better picture for us of when were the ages of cancer diagnoses, what kind of cancer, were they colon cancer, were they prostate cancer, were they ovarian cancer, uterine cancer, breast cancer. Those are the cancers we probably tend to hear a little bit more about that tend to be of a hereditary nature than, say, the livers, kidneys, bladders. So the types of cancers do also come into play when we're talking with a patient. And this is where we probably spend 45 to 60 minutes with people in their initial visit to get some of this information and help guide these conversations to get a better idea where we should focus in that cancer or cardiac or pharmacogenetic screening to decide if testing is even right for you, if we think that you may be at an increased risk for a hereditary condition, or if it's something that maybe just some lifestyle or environmental sources would be more appropriate in terms of risk reduction, things like that.
Because some cancers have a tremendous environmental, mesothelioma and asbestos, et cetera.
Yeah.
But I've often thought about, tell me about how patients react to this. So, they said, we can find the gene for dementia, for Alzheimer's disease. Sure. Well, if I'm feeling fine, why do I want to know about that? Then every time I misplace my car keys, I'm like, oh, here it's starting. Here it's starting, I can think, I could imagine there'd be certain patients that to learn their genetic profile, they would be like, oh, I can't, buy snow tires or oversized jars of mayonnaise because I have this genetic profile. Do you encounter that?
And and that a lot of that comes up in the conversation. We do say that this is not an emergency. Genetics is not something. So if you're not prepared in your life, if there is a cancer diagnosis going on, that's priority of caring for, if it's your personal cancer diagnosis or your family member, that usually this information isn't something that's emergent, that's not needed right this second. So there's definitely, if there's a lot of anxiety or psychological, things going on, we can definitely say, hey, here's the information. This is what we're thinking. This is what we would offer, but at a better time for you, maybe considering testing at some point. So it's definitely just more about having a conversation about what it is, looking at if they're appropriate, if they're not, what kind of testing, would we offer, but then deciding on the right time, because you need to be ready to be able to, some patients are really like, yes, I want to know. They're super proactive. They're in that mind space to be able to act upon it, to hear the information. But then we have some that's like, no, I don't want to know. Okay, then you probably shouldn't go forth with testing at this time. When you're ready, come back to us, and
And I think we pride ourselves on, we have the ability to take time and have a really good education session with you. And so I think sometimes patients come in and they don't know what they don't know. And so we can kind of explain really what the genetic world is. And so maybe they've come in convinced that they're doomed to have cancer. And when we sit down and we talk about it, we're like, really there's only been 2 cancers in your family, and they've all been in grandma and grandpa when they were 95, and they weren't truly hereditary cancers. And so sometimes that offers reassurance for patients. And then they may not want to test because, like you said, they're anxious. They're afraid that then they're going to have this dark cloud hanging over their head that they will develop a cancer. And we can kind of take that time to talk to them that having a gene that doesn't work does not mean that they will develop a cancer, but educate them on signs, symptoms that they could look for, or things that they could do in terms of screening proactively. And so they may elect not to proceed with testing from a genetic standpoint But then there are things that they can do that they feel like they are still being proactive about, that, again, they may not have known, or if they would have done the 23andMe or the Ancestry.com, they're not getting the full education piece. And so sometimes just having a really good conversation with us can be beneficial for those patients too. So we don't want them to feel like if they come in, we're going to hold them down and take a sample of their blood.
Right.
But again, just really empowering them from an educational standpoint can be helpful, not only for them, but oftentimes people will come in and say they're doing it, for their family,
Right.
if not for themselves. And so I think that's really something we take pride in, is that they leave feeling empowered from the education that they garnered with our visits. So
Yeah, I think the you mentioned that you don't know what you don't know. I think that's true for physicians and clinicians, because in my 27 years of practice, the degree of genetics has expanded exponentially. Francis Collins and the Genome Project completed probably in the early 90s to mid 90s, somewhere in there perhaps, right? Does that sound about right?
Yeah.
So, there we just mapped the genome. I mean, didn't know what that meant other than we knew the location, right?
Right.
And that was a big deal. And now, I've learned this just through some stewardship of accountability for laboratory testing, et cetera, that the expanse of testing and the expense of testing both are just enormous. And what you do with that testing. So, I think as clinicians, the service you provide the physicians, the clinicians caring for these patients, is to be a little bit more strategic with testing than just, this random test that we recall from our practice might not even be relevant anymore,
Right.
or may not, do anything for the patient, or may not,
it may not be beneficial to you as a clinician, and it may not be beneficial to the patient.
Right.
And so I think that's where we're there to help guide not only the patient, but the clinician.
Yeah.
So if, as a clinician listening to this, if you have a patient that comes to you and says, I want genetic testing, and you're not sure if they're an appropriate referral to us, the patients don't need a referral to our clinic unless their insurance for some reason would deem that as a requirement. Unless they are a cardiac patient. If there's someone that you're wanting to do cardiac genetic testing, we do ask that comes from a cardiologist. So if the patient has not seen a cardiologist, you could refer them to Unity Point Cardiology or another cardiologist if there's someone closer. And then if the cardiologist feels it's appropriate for them to come see us, if it would change their management, then the cardiologist would refer to us. But for pharmacogenomic testing or for a hereditary cancer, then the patient could self-refer. Or if you have someone coming to you and they're in your office, you could just make a referral to our office, and then we would call them to get that set up. And then that takes the work off of you trying to decide, what test do I order? Where is this enough?
Right.
What's the cost? Do I
Right.
need a pre-auth? Do I not? And then we then convey that information back to you. We educate the patient once we get the results back. And then we come up with a management plan for the patient. And I'll let Alyssa kind of talk about the follow-up on that too.
Well, if I'm a clinician, I just randomly order the test. One, that's just not good care in this day and age. And it's negative. If it's positive, then they're just like, oh, it's positive, I got to send it off to you guys, right? I'm like, okay, I have a positive test. But if it's negative, that may or may not have been of benefit to the patient. You see what I'm saying? So,
Yes.
There's some tests that return negative. We can list them out. It says a lot, and you can reassure the patient. But the expanse of genetic testing is astronomical, truly astronomical, which is interesting, and it changes quickly.
For sure.
I think one of the bigger things is, and we often prepare patients a lot before the test. That's a part of our pre-testing counseling visit. Because if you're testing for a lot of different genes, sometimes you never know what you're going to get. Sometimes we get surprises. So, while we don't cover every single gene and every possibility, we do take some time to kind of mitigate any surprises or, results that, we might not be able to, we don't even have information on that gene, or the result is uncertain. We kind of prepare them ahead of time. So when we make that phone call after the test results in, the patients, I think, already have a general understanding of all the possible results they could have gotten. So that phone call, I think, is actually a pretty simple conversation for them. And so we do a lot more work on the front end so that the back end, everyone has kind of like a clear picture. Yeah.
What about pre-existing conditions? What in both your training, did you ever come across that topic? I'm sure you did in discussion that I get tested and it says I have, this cancer risk, and then later my insurer drops me because, well, Dustin, back in 2024, you went to the Alyssa show and were tested and you had it. How does that work? Is that a real problem?
So I think the question we get a lot
is that a big enough problem that a patient say, oh my gosh, I better never go to this clinic?
So I feel like we get 3 questions. Am I going to end up in some police department because my DNA gets connected to a crime that a family member can, it's on every CSI show. Is this going to affect my life insurance? And then is this going to affect my health insurance, which I think is the pre-existing condition. Yeah. And there's actually the GINA law that got passed, which is a federal law. So your results from your genetic testing, which truly only would come into play if there was a positive result found, cannot affect your current health life insurance. So that's null and void for patients. So they don't need to worry about that for their health insurance. Again, in our conversation with patients, we talk about life insurance because that's not federally protected. And so sometimes, especially in the younger patients, if they haven't kind of established themselves or figured out all of their life goals.
Well, they don't have their mortgage yet and their kids.
Yeah, they don't know. We have a conversation about that because I can't predict, looking at them, looking at their family history, what these results are going to say. So we have a very honest conversation about, maybe they should consider this, kind of like gambling. Do they want to gamble that this comes back negative? Life insurance won't change, or do they want to gamble that this comes back positive, and then there's the very real potential that their life insurance carrier could have a conversation with them that rates go up, they change their policy, things like that. So we do discuss with them about life insurance, that the implications from a positive screen could have. And then the third is that no, they won't end up in a police department because this is not the same DNA that ancestryandme.com or something like that has. It's just like any other HIPAA protected health test result. It stays with the lab that does that. So they're not going to be connected to some long lost relative that they
because you're testing for specific genetic deficits.
Right. Yes.
There's not necessarily their entire DNA.
No paternity.
Right.
But those are the common questions that I think we get. Again, misconceptions. People don't know what they don't know. They've just read something, they've seen something. And so again, it's where we get to have these conversations with patients so we can clear up those misconceptions, and then they can make the decision, is it right for them? And if now isn't the right time, then they've at least had the accurate information to make the decision that's best for them. And we have an honest conversation about what cost maybe look like to give them and their insurance carrier the best chance to get an accurate estimate of what that may look like for them. And for some people, it is very reasonable. For other people, it's a little more than they would be comfortable with, but the lab that we use is very good about a patient assistance program. And so most people should not have to pay more than $250 to do a genetic test result. But again, that's where we can help not only a clinician work with that and getting the right labs ordered, but then also the patient, so they're not getting stuck with a bill.
Absolutely,
at the end. And surprises, I think, is really what we try to avoid.
Right.
Yeah, and to pay for an expensive test that is of no value.
Absolutely.
That's horrible.
It doesn't help anybody at the end of the day.
Right. It's one thing if it does help, but if it doesn't, then
they're going to be mad at everybody. Yeah. You, us, them. And if we find a positive, they're really going to be mad, So we try to.
Most of my physicians' friends quit listening to the podcast when you said we handle pre-authorization. They were just like, Okay, that's where I'm sending my patients.
Yeah.
And they just
And the
turned it
lab
off,
does it
yeah.
for us, so that's
Yeah.
why it
yeah,
really works.
yeah, I'm sure they were just like, okay,
Yeah.
that sounds good.
And if they come up with a really good name, we should have a T-shirt for the
Yeah.
best name that gets submitted. Or
Absolutely.
something,
Yeah,
Some
right?
sort of
We'll see who's listening to the
promotional
end of
yeah.
this whole podcast to hear that.
23andMe. What can I really don't know a lot about it. I mean, what do they do? What do they test for? Have you ever seen do people come in with 23andMe to clinicians and go, okay, what's this mean?
So we like to say that the 23andMe and Ancestry.com is for fun. What we do is scientific.
Okay. That's good. No, that's great. I mean,
And also it's been interesting because we ask about ancestry, and I literally had a patient pull up their ancestry and be like, I am such and such Scottish and I am such and such German. I'm like, that's great. Thank you. It helped me answer this question. It doesn't, it's important that we understand ancestry because, we find some of these genes are more prevalent in certain populations of people, like Ashkenazi Jewish population. Right. That's a big one. So I had one where she was like 1% Ashkenazi Jew. From her ancestry report, I'm like, that's great, but then it really doesn't, this type of testing is, something different.
Yeah.
Yeah.
I think for some people, it may pique a curiosity. I don't know in the scientific world from a clinician standpoint that it's truly validated to the degree that a scientific lab would be enough to make me feel comfortable if I got a positive or a negative. Because then we've seen those results where someone was told they had negative genetic testing, but when it's done in a medical grade scientific lab, those are not the same results that they get, or vice versa. When someone's come in with a positive result from I call it like an over-the-counter 23andMe or an Ancestry.com. Oh my gosh, I have these positive results. I'm freaking out. What do I do? And we take a step back and we validate with the scientific medical grade results. We find out that they actually aren't. So I think, again, like all things, the level and degree where we can validate, if it's enough that it piques your curiosity, but I don't know that it would be enough with a strong family history, personal history, I would probably want to pursue a more validated scientific comparison to make sure that those truly are accurate results if someone has that.
Well, I've always told it, patients, family, friends ask about it, and I'm always like, save your money. Yeah. I mean, if it's a television commercial, just save your money.
Yeah.
Yeah.
And that DNA may end up connecting you to some of those other
things
that we talked about.
I think that Michelle, if you grew up in Cedar Rapids, Michelle Martinkle murder,
absolutely,
that was off one of those ancestry things, right?
Yes, it was. And
which is kind of cool in a way that that's total
and I think
CSI, SVU.
Right.
Why patients come in and ask if it will be
Yeah.
connected. And we have also had patients who have connected with half siblings that they didn't know existed that they've found through doing these tests, So again, if that's what you're looking for, then again, it piques your curiosity. If that's not what you're looking for, then you may be better off coming to see us.
Yeah. If you watch SVU, sometimes they find out stuff you didn't want to find out.
Exactly. Exactly. Yes.
Well, I think we've given great advice to physicians to use the service line to become more efficient in their genetic testing, and not only to benefit their practice but also the care of the patient. What advice do you have for patients about the clinic? I mean, we kind of talked about the counseling. We've kind of talked about which I think that's so phenomenal that you prep it with counseling prior to testing. That's important, rather than shooting first and asking questions later, sort of metaphor. But they can see you without a referral unless it's cardiac, correct? That's what you said, Melissa.
Yes.
Okay. And even if they're not with a family history, that doesn't mean that they can't be screened, but it's more beneficial to have some sort of family pedigree. Did I summarize that correctly? What else would you like to say about the clinic?
If they're curious, on our website, they can take like a screening questionnaire, and then that comes to us. So if they're like, I don't know if I need to see you guys, I'm not sure. I don't have an upcoming appointment with my primary. There is kind of a very abbreviated medical questionnaire that would come to us that we would take a look at, and then someone from our office would reach out to them.
That is at Community Cancer Center.
The Nassif Community Cancer
/ genetics.
Yes.
Okay.
That they could look at that.
Yeah.
And that also has the family history questionnaire that we would want them to fill out if they were going to come see us as well. So if they were curious and wanted to kind of start gathering some information, sometimes that helps facilitate to answer their questions if they think a referral to us may or may not be beneficial. And I think too, just if they're thinking what cancers may or may not be cancers that we tend to think of hereditary, I think the big one that comes to everyone's mind first off is breast. That one probably gets the most media attention. We've have the best screening methods for that. But others that we tend to maybe overlook, men with young prostate diagnoses at a young age. So if that's you or a loved one, we would love to see you. And it's not to say that that changes anything, but again, it may be something that has not been discussed. And then unfortunately, like ovarian and pancreatic cancers, because those screening modalities for early detection are not great. And so unfortunately,
just the location of those organs,
we're catching those at later stages.
They're advanced, yeah.
Yes. Mm-hmm. And so if there was something that we then can do for family members before there would ever be a cancer diagnosis, we would love to do that. So if you've had a loved one with a diagnoses of pancreatic or ovarian cancer and you're not sure, we'd love to have a conversation with you if it's something you're interested in.
I mean, I think, pancreas, we've seen some advancements with ultrasound by endoscopy and MRI modalities, but still ovarian, it's advanced when you find it.
Absolutely.
So if you find it or it's not advanced, that patient was really lucky and fortunate and blessed.
Yes.
Yeah.
Am I missing any?
And I just we always follow up when we get the test results, there's always a phone call to explain what the test results mean. If there's a positive result, we welcome everyone, we almost require them to come back to have an in-person conversation about what the positive results mean, because we want to kind of help set a plan in motion of who they're going to need to follow up with after, whether they need to go to the high-risk clinic here, or is it PCP or their GI specialist or their OBGYN. So, it's important not only about the testing and what the results show, but then what do we do? And so, for all the positive results, we want to have them come in with some family members too, because their family members are likely going to be interested in testing and maybe want to hear this conversation. Right. So come in together. And then I think that's a part of our service that I want to highlight is that we help establish a plan post follow-up of your results so that we're making sure we get you access to the necessary care for whatever screening or,
Well, this is great information, and you guys both have your why, and that's obvious, and you're going to fit in really well with the staff over at Nassif Community Cancer Center. We always enjoy having them on the podcast. They're always very passionate about what they do. They're very for real people that just enjoy being around them. Thank you so much for taking the time to talk about this again. This is Melissa Janssen and Alyssa Grissom, genetic nurse clinicians with the Genetics and Cancer Risk Assessment Clinic at Nassif Community Cancer Center. To see if genetic testing may be right for you, take the genetic testing questionnaire on the Community Cancer Center's website at communitycancercenter.org/genetics. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.